Greetings, greetings, greetings. It's good to have you with us, Brother Malcolm. Thanks for joining us. We are, of course, always seeking out and trying to delegate, relegate, and promote different organizations and businesses. We find ourselves in the middle of a tremendous opportunity here. I just want to reach out to you just to make a formal reception introduction. Thanks for coming to our Logan's event a couple of weeks ago. We appreciate you being there. And we hope that you got something out of that that can give you and yield to the future and your success. How did you tell me about yourself and how did the event on last weekend go?
Okay, well, a little bit about myself. Uh, I I like to start most time when I'm introducing myself to people for the first time. My name is Malcolm Lewis, and I'm a sinner saved by grace.
Okay.
I currently pastor St. Stephen's Missionary Baptist Church in Goldsboro, and also Anderson Chapel Missionary Baptist Church in Macclesfield. I've been in the pastorate for over 30 plus years, in the ministry 40 plus years. Born in Pender County, raised in uh, the King Tuck community of Pender County,
Oh,
and married to Lois Lewis, and we have 6 children and 13 grandchildren. We just recently had a new addition, so
oh, very good.
13 grandchildren.
Very good.
So
Very good.
that's a quick overview of myself. But I am a I consider myself a servant,
Uh-huh.
uh, and we operate along with the under the leadership of Joe Jackson of the
All right.
Belfast Missionary Baptist Association,
Mm-hmm.
uh, he's the moderator, and we work in conjunction with the Baptist men in North Carolina to provide free dental services to uh, the Goldsboro, Wayne, and surrounding communities, counties.
Mm-hmm.
We
Mm-hmm.
have been doing this. This is our 7th year that
Mm-hmm.
we have done this. Last year, we uh, added the addition of doing health screening.
Okay.
And actually, I say last year we added the addition, but we have been doing diabetic screening for a number of years along with the dental unit. But last year we went full blown with the health screening as we start screening for cholesterols, diabetes, heart risks, depression, and we even can screen for vision, but all of these services require volunteers, professional volunteers.
Mm-hmm.
And the past couple of years, I have not had a eye doctor to volunteer. I've been working, trying to get that area filled so we could screen for glaucoma also if we have an eye doctor.
Mm-hmm.
But and we do the other things. We take the blood pressure, the height, weight, uh, body mass index and pulse. But that is we are doing the health screening this weekend on
Mm-hmm.
July the 21st and 22nd. We'll start at 9:30 uh, a.m. on Friday morning and Saturday morning, and we anticipate ending at 5 p.m.
Mm-hmm.
both days. We
Mm-hmm.
operate, as I stated, through the volunteers, professional volunteers. We have we'll either use a RN, a PA, and we use LPNs, CNAs, uh, any medical technician that's able to draw blood and perform the necessary medical services. And we also use lay, excuse me, we also use lay volunteers,
Mm-hmm.
church members, community members that come in and they help by registering the uh, patients as they come in so that we can make a smooth flow. We also are doing this weekend, we also have the dental clinic with us again this weekend. Last week we had the dental clinic with us and we serviced over the 2 days, probably right at about 40 individuals.
Mm-hmm.
And that's great considering the fact that we only had one dentist and one hygienist with us both days, but they did a wonderful job. moving them through. Dr. White, who has a practice in Goldsboro, and Dr. Frazier, who has a practice in Smithfield. They did a wonderful job of moving these individuals through. So we thank God for them, along with the hygienist, Myrtle Reno, who came in from Virginia to help us. So we did a wonderful job last week, and we are looking forward to another grand session Friday and Saturday.
Okay.
Now, I tell people this, we could take that health unit, park it down a 3-mile country road. And if you, excuse me, we could take the dental unit, park it down a 3-mile country road. And if you have a hurt tooth, if your mouth is aching, if your tooth is aching, you're going to find that dental unit.
Okay.
The problem is when it comes to health screening, if it doesn't hurt, we don't screen for it.
I see. I see. No, well, that's a big deal. That's what I
Yeah.
mean. It sounds like you've been quite busy and you've gotten a lot done. And congratulations on your success on the success of last weekend. And I'm sure this weekend you'll have as good or great or of success. And when it comes to pain, you know, we if there's a relief out there for it, we pray that your people can help and find and deliver a great relief for them. So, but in that way, hey, you know, keep screening. I give you all the benefit and the endeavors to get your work done. So now, when it comes to positions that you are bringing in, and they're from all over now, an eye doctor would be substantial, especially considering blindness and loss of vision and that kind of thing. But you know, keep pedaling. You'll get the success you're after. Keep pedaling. You
But I
know.
think one of the things, a conversation like this and getting the word out helps along, because even we attended one of your functions at Logan a few months ago, and just being there attending Logan, that function there has put us in network with some contacts that otherwise we wouldn't have had. So we have received some monetary contribution. We have received some valuable networking news and information. So it's been wonderful. And one of the greatest needs that we have nationally, we need the professional volunteers. We need dentists, we need hygienists, we need dental assistants, we need doctors, we need PAs, we need nurses along those lines. But one of the other things that's always useful to have, good old cold cash.
Right. Okay. I got you. Now, I think I remember talking with you, and I asked you particularly, you know, what would be a great, I mean, what targets would be great? I mean, in terms of financial, to put you in.
Let's stop.
Hold on one second. I mean, we've